Hey, Ravi, let us start.
Can you hear me? Okay? Hello?
We can hear you, but disturbance is there, background disturbance.
Okay. How is it now? Right. Hello. Can you hear me okay now?
Yes.
Okay. Thank you. Welcome all the residents of One City for this session, educative session on COVID. My name is Ravi. So we have several eminent doctors on the call today for us giving us the information on COVID, how Omicron, how situation is on the ground. Okay, so I'll introduce all the doctors now, and then I would ask R.K. Garu to moderate this session. So here we have Dr. Khyati Tiwari. She is a public health expert and she works for UNICEF. Then we have Dr. Nagesh, who is the Group Chief of Operations, Omni Hospitals. Then we have Dr. Priyank, who is andrologist at Apollo Hospitals in Kondapur. Then we have Dr. Srinivas Reddy, who is a pediatrician and who runs a hospital for treating COVID patients. Then we have Dr. Lavanya. She is a pathologist and she also runs this COVID hospital. Welcome all the doctors. Thank you for your time. I think it's wonderful to have you all. We salute you first of all for doing the service to our community. I think a lot of help we got for the residents here in One City as well. So hand it over to RK Garu. You can moderate the session.
So thank you so much, Ravi, and for the introduction. I think it is a Sunday afternoon for us, for the One City people to join a wonderful session to understand more about the COVID and its shape, and then as well as the different viruses which has been attacking us, and then we are reeling under tremendous pressure. Okay, for the benefit of everyone, that this session is being recorded and we are going to publish this in the public domain. So the people who could not able to make this session and then listen to the doctors can definitely make utilize of the recorded session. Okay, so now I first of all I request Dr. Khyati to introduce and set the stage of this new session, because now around a year back that we have done the similar session, and then lot many people got benefit out of this session. Okay, so Dr. Khyati.
Yes, thank you so much. I'll just share my screen. Please
Please go.
confirm if you can see my screen.
Yes, we can see.
Okay, fantastic. So, good afternoon, everyone, and hope that this session is worth your while and your nap. So, I'm starting with numbers because this is something which terrifies a lot of people, but today we have some encouraging numbers. And after around 26 days, while the number of active cases are continuously increasing, we've seen a decline in number of active cases to increase. It has actually come down from 90s to 70,000s. What we've seen is that while the number of new cases remain very high, the positivity rate has now started to climb down. The four metros in India, Mumbai, Delhi, Chennai, and Kolkata, are already at their peak, and now they are witnessing a decline. For all other major cities, there will be a curve that we should observe in a couple of days. What is interesting to note with these numbers is that, in comparison with the first and the second wave, the inpatient rate or the hospitalization rates are very low for this particular wave, which is an encouraging factor. The number of days which are required for recovery have also come down. From here, I'll move on to Omicron, and what actually brings us all together here is the new variant of concern, which is Omicron. Omicron was discovered in South Africa in November. And while there have been multiple mutations for COVID that have happened so far, Omicron is a variant which caught the eye of WHO because this particular variant shows a very, very speedy transmission rate. What we've seen is the increased infection rate of Omicron that becomes a cause of concern for everywhere and for everyone in the country. And that's one of the reasons why it's been noted that if one person in a household is positive, there is a likelihood that all others will become positive very quickly. And this is one of the reasons why wearing a mask when you're positive in your house becomes even more essential. Why do variants occur? This is something which has been asked by a lot of people, and we've seen this as a concern also. While we've been looking at only a few variants which are shown in the news or which are, about which we read in WhatsApp and other things, let me just tell you one thing, that since the time COVID-19 started, it has undergone multiple mutations. There are multiple mutations of COVID-19 which has happened, but once in a while, there is this one variant which is identified as variant of concern. It can be either because its ability to infect, replicate, or transmit itself is significantly higher than other variants, or it may show some symptoms which are different from the symptoms that we already know are a part of that particular disease. And hence it becomes very important for the scientists and people from public health community to identify and talk about it a little more. And that's what happened with Omicron. This does not mean that after Omicron or after Delta, the mutation of COVID-19 will stop. There are chances that it may undergo mutations continuously, but the chances of a new variant of concern will probably decline. And that's again a probability, not confirmed. How can our present diagnostic methods detect Omicron? Now, something which is very important to know and understand is that RT-PCR remains the choice of detection. So if you are, seeing symptoms similar to COVID, you have to undergo a RT-PCR test. RT-PCR will not tell you whether you have a Delta or a Omicron. It will tell you that you're positive for COVID. For identifying what variant or which mutation of COVID-19 you have contracted, it will require a gene sequencing, which takes a lot of time. By that time, it's likely that your symptoms may also come down. So right now, Government of India or any other state government is not recommending undergoing gene sequencing for symptoms similar to COVID. But with a pinch of salt, the new testing methods which are available, which can be the rapid antigen testing or the home test kits, while they seem to be a easy way of testing for COVID-19, they are not the most effective way of testing. There are chances, and the chances are as high as 70% that it may give you a false negative. So RT-PCR remains a test of choice for COVID-19. Then there are issues now regarding existing vaccines that we've taken so far on Omicron, and how is it providing us with protection because the virus is mutating, and we've taken a vaccine which was developed in 2018. Does it still remain relevant? Does it still provide us with protection? While we know that the virus is changing its RNA, it's changing the protein with which it is made up of. The vaccines actually create antibodies which provide you with cellular immunity. These antibodies are already there in your body, which provide you with some level of protection. Vaccines only provide you protection after you have contracted the illness. Vaccine will never prevent transmission of the disease. The second thing which we know and we hear of is hybrid immunity. During the first and the second wave of COVID-19, it was anticipated, and we do not have data for that. It was anticipated that 2/3 of Indian population already became positive for COVID-19, with or without symptoms, with or without testing, with or without knowing. And then there was a massive drive of vaccination that was taken up, and most of the people were then vaccinated. So then this antibody which your body produced when you contracted COVID, and the antibody which was injected when you got vaccinated, is actually providing you with a shield, which is now giving us the protection, which helps us in reducing the kind of symptoms that Delta or Omicron presents with. And that is one of the reasons why in India, in comparison with any other country, we are finding that Omicron symptoms are actually mild in most cases. There are cases where we have seen severity, but these severities are more likely to be associated with existing comorbidities and not because of the virus itself. So yes, the existing vaccines are still providing protection against the various mutations till such a time that we have a new improved variant or a new improved vaccine. We will continue to adhere by the guidelines that are existing with us. What are the precautions that we should take? And these precautions remain the same as the first and the second wave. We will need to wear masks. We will need to wear masks properly, and not just for the sake of wearing masks. Right now, there is a lot of debate around what is the kind of mask that we should wear. Presently, we know that N95 works the best. Or if you're wearing a cotton mask, you can try wearing double layering. You can do a cotton mask, and then you can try a surgical 3-ply mask over it. That may provide you with similar kind of a protection as N95. Take both the doses of vaccine. For those who are eligible for precautionary dose, can also go for that. Continue to maintain social distancing. And something which is becoming more and more important now is maintaining good ventilation. Otherwise, with more people getting infected of COVID-19, it becomes a possibility that even after you're free of COVID-19 symptoms, the virus may continue to linger in your household. So there is a need to start disinfecting if you have contracted or if somebody in your house has contracted COVID-19. I will not go into this because I know there is a huge array of doctors who are here. So if this is not covered, I will come back to this. But I'll move on to this. And it's an important thing on which we've received guidance recently from Government of India. It is called multi-system inflammatory syndrome, MIC, in children and adolescents. And this is something which is linked with COVID-19. So for children who have been exposed or infected with COVID-19 often undergoes some other symptoms, which can be fever or associated symptoms like rash, like some acute gastrointestinal problems like diarrhea, vomiting, abdominal pain, and others. And along with that, in some cases, there are also shock-like symptoms. There are symptoms related to coronary abnormalities that we've seen, symptoms related to inflammation, which is often detected by the blood test that the doctor advises you to get. That is increased ESR rate. The ESR goes beyond 40. There's an increase in C-reactive protein. There is no obvious inflammation. So people, when they notice the increased ESR rate, they feel that there's some kind of inflammation in the body, and that is leading the body to increase the ESR rate or the C-reactive protein. But you'll find that there's no obvious inflammation or bacterial sepsis or any other thing. This is the most probable cause for that, which is now being identified as multisystem inflammatory syndrome. And this is occurring mostly in children, not in adults, mostly in children aged 0 to 18 years. And hence, it becomes important to start looking at protective options for children. Those children who have already become eligible for COVID vaccination may undergo that. For other children, flu vaccination is also providing a protective cover from this illness as well as from the COVID variants and the other viruses. So I'll stop here and I'll hand it back to the organizers, and I'm happy to answer if there are any questions.
Thank you so much, Dr. Khyati. And people who wants to have any, ask any questions, then, please type it in the chat so that, we will look into that and ask the respective speaker to speak or answer the questions posed. So thank you so much, Dr. Khyati. And then the takeaway points for us is, very quickly at the introductory session is in the major cities like Mumbai, Chennai, Delhi, and Calcutta, the graph is going up. And the good news is that, at some point of time, it is going to go down also. And it has got the COVID-19 has got multiple mutation. And then the current one is that what we have Omicron. And then Dr. Khyati has introduced about the shape and then the kind of virus which is attacking the people. And there is no point in just going for the genus sequencing and trying to identify which variant or which mutation part of it, rather than going for the test and then identify whether you have COVID or not. Instead of going for home test cases, better to go for COVID-19 RT-PCR test directly and identify. And I think I request Dr. Nagesh to jump in and then talk more about the phases of this COVID, what we have, the wave 1, wave 2, and wave 3 right now where we are, so that all the audiences of one city will be benefited out of his discussion. Dr. Nagesh, please. Am I audible?
Yes, I think Dr. Nagesh is on mute.
Yeah, the thing, You can unmute yourself and speak, sir, Dr. Nagesh. Does he have any issues of internet? Can you please call him, Ravi, once?
Artikar, he's not able to unmute himself. Can you unmute him? You can. Yeah, I think now he's on. Hello.
I did unmute him, but he has to do from his computer.
No, he is muted again. Can you? Yes.
Yes. I think, he dropped out and is trying to rejoin.
Okay.
Hello.
Yes, sir, we can hear
Yeah.
you.
I'm audible, right?
Yes.
Yes.
But can't see you well though. It's
All
dark.
right. Okay. Thanks for the introduction, RK Garu and the Ravi Garu and team. I think coming to the discussion, I'll be mixing up a bit of Telugu and English, and if there's some problem understanding at any level, please do try to stop us, and then probably we can take it up the way that is more convenient for the audience. So the first point is we've been hearing a lot about these waves: first wave, second wave, now third wave. I mean, what are the differences? I mean, is there any difference between the wave one, wave two, wave three? Is the first question, or probably there are lots of people who must be thinking, how many waves are they going to see again? It's again 22 now, and is 23, 24 going to be the same, and more waves to come forward? In the first wave, if we see the pandemic started with very high infectivity rate. At the same time, the mortality was very moderate. What do I mean by infectivity? Infectivity ante enti, mortality ante enti. Infectivity ante ఒకరి నుంచి ఒకరికి జబ్బు వ్యాప్తి చెందడం. So it's a spread of disease between people. Now that is called infectivity. What is mortality? Mortality is it's a number of deaths those have happened or occurred because of this infection. So mortality is like the end result of the infection which have costed lives. Now mortality in the first wave was moderate. It was not severe. In the wave 2, the mortality was severe. Now wave 3, mortality is milder. What does it say? What does it really mean to us? Now the mild mortality is like, we are getting better. Probably the virus is getting weaker, I would say, though the infectivity is very, very high in the third wave compared to wave 1 and wave 2, but the mortality is very mild compared to wave 1 and wave 2. Now, what is the reason for mortality being high in wave 2? It's nothing but Delta. The Delta variant was one which has actually taken a high toll on human beings as far as the deaths are concerned. Whereas now the third wave is because of Omicron, and the mortality is on a milder side. The hospitalization itself is on a milder side. So wave 1 versus wave 2 versus wave 3, I would say we are better today, and there's nothing that we need to get panic. And probably yes, the caution should always be should always be exercised, and at the same time we need to spread the infectivity. We need to cut down the spread of infectivity and stay safer, so that the infectivity rate lies at the minimum of its whatever level that it is right now. The mutation of the virus that happens between every wave, and which can actually result in number of multiple waves, the mutation can be on the stronger side, can also be on the milder side. Now, as we keep increasing our immunity levels better than the virus, probably the waves might come again, but the I think human beings will definitely win over all these waves, and over a period of time, with the help of herd immunity, I'm pretty sure that we will win the battle against this pandemic very soon. So I would say it's a good news for us. Wave 3 is very much under control, and we are able to tackle it at a better level than any other country in this world. And I think the mortality will definitely be will not be let rise again, and the hospitalization will also be at the lowest level possible. So today, who requires hospitalization? Again, someone who has got high grade temperatures, whose saturation is less than 93%, severe cough and breathlessness, should go get hospitalized. Anyone who is better than these parameters, the best parameter that you should always look at is temperature and the saturation. If you have saturation pulse oximeter at home, the saturation can be checked. సాచురేషన్ 93 కన్నా తక్కువ ఉంటే, జ్వరము 102 కన్నా ఎక్కువ ఉంటే, సివియర్ కాఫ్ ఉంటే తప్ప హాస్పిటలైజేషన్ రిక్వైర్మెంట్ ఉండదు. That's a take home point. In case, do we really need to go and see the doctor? Yes, you are supposed to go and see the doctor rather than just getting the RT-PCR done or any other rapid antigen test done. It is better you go see the doctor. As per the doctor, probably is advisable to practice, because if there is someone who is not able to assess the severity of his own symptoms, they definitely need to look after, I mean, they need to go and visit the doctor. And as I said, if you are able to assess your own severity of your complaints, you can still stay at home, provided you carefully monitor your saturation, your temperature. If your saturation is less than 93, there is an immediate requirement for you to go and see the doctor. If it is maintained above 93, I think it's much better you monitor yourself. If you can, stay home, stay safe, and then take the symptomatic medications to treat yourself. Probably the medications will have to come from the by the doctor's prescription again. Now, what are we seeing in hospitals these days? Though there are high number of positives that we counter across the OPD visiting patients, not even 2% of them are getting admitted. So even the clinical scenarios look much better today. The hospitalization is very, very minimal and negligible, and people are successfully being treated very with a good success rate based out of home isolation. So the treatment related, are there any new developments, is the next point. Now, recently ICMR have clearly stated that the plasma therapy has no role in treating COVID. So we ran pole to pole, pillar to pillar to get plasma, and then plasma therapy has been advised and administered to a lot of COVID infected patients in Delta during the Delta wave. But now it's a different scenario. ICMR have clearly said plasma therapy has no role. What is WHO saying? WHO says plasma therapy definitely has no role, but now they strongly recommend cocktail as well as remdesivir to a certain extent. But whereas ICMR clearly says the main course of treatment remains the same, that is oxygen, steroid are the most important therapies that those are available. The supportive therapies, remdesivir, and then tocilizumab and the cocktail. Now, what is cocktail? Cocktail is nothing but the monoclonal antibodies which are used these days to treat COVID. Now, cocktail is given it comes in a single dose. Each injection of cocktail costs around 1,20,000 rupees. Once the injection is opened, it should be consumed within 24 hours. One injection can be given to 2 people. So ideally, a cost of cocktail per patient is around 60 to 65,000 rupees. In case if they don't have 2 patients at a time who can take antibodies, the single patient have to bear the entire cost, that is 1,20,000 to 1,30,000 rupees. So antibodies are given over a period of 1 hour, 1 to 2 hours injection. 1 dose is enough, and we have seen, and this can be only given within 5 days from the day of day 1. So if you had a cold on day 1, cough at day 2, and fever on day 3, and you go to hospital before day 5, you are an eligible candidate to receive monoclonal therapy. In case if you cross day 5, antibodies will not have any kind of a role. Monoclonal antibodies, they will not have any kind of role. So cocktail can be taken within 5 days from the onset of the symptoms. Now, what are the other new therapies which the WHO is recommending is baricitinib. Baricitinib is a tablet which is an immunomodulator tablet, which seems to be working very, very well in the COVID. So WHO is strongly recommending baricitinib can be used. And in India, yes, we have this baricitinib available and it is being used. The other new therapy is molnupiravir. Molnupiravir has got lots of side effects, though but I think it is still under evaluation whether to be used or not to be used. Molnupiravir is strictly contraindicated in pregnancy. So in pregnancies, we don't use molnupiravir. So with these new therapies, I think what we need to understand is the treatment options are getting better day by day, and the more amount of transparency is coming up as far as the availability of medications are suggested. Now, the most important thing is, people still carry that feel of, will I get remdesivir now? Why are we not being given remdesivir? Why are we not being cocktail? Why are we not being given tocilizumab and all that? I think these questions are supposed to be left at the discretion of doctor to decide which kind of therapy is suitable to whom and when to be given. The most important aspect which I would like to inform you all through this forum is, the therapies are getting better. Some therapies are being delisted from the approved list, and some therapies are still under consideration, which are still being worked upon. So I think you all need to know what are the therapies which are listed and approved before you taking up, because there are some centers and there are some practitioners who also talk about stem cell therapy and other so-called some therapies which are delisted. I think we need to be very careful before we take up something on our own consent. Now, the third point which I would like to bring upon is regarding the booster dose. They say booster dose right now is only for people who are above 60-year-old and for the healthcare workers. Booster dose is found to be very effective against Omicron by improving the T cell activity in the body. But I think booster dose, again, the guideline clearly says if you have received first 2 doses of Covishield, it should be the Covishield, and if it is a Covaxin, it should be the Covaxin as a booster dose. But I think there are different school of thoughts working on booster dose, because Israel have published a couple of papers on the same, whereas there is a mix of the booster dose, varies from the main master dose of initial 2 doses. I think it is still yet to be evolved as a full published. It's all a journal which has been published, nothing in specific yet. But I think as a guideline given by the Indian government, I think going for the booster dose is always going to be an added advantage, and it is recommended that all the eligible people should go for booster dose, and which can actually help us fight against this infectivity of Omicron. I think the pediatric related vaccination part will be covered by the expert available on board, I believe. I think this is all from my side. Thank you so much. And I'm open for any kind of questions to be taken up.
Thank you so much, Dr. Nagesh. I think, it's a wonderful session. And the takeaway points for every one of us is that, the first thing that what Dr. Nagesh said is that, the waves, first wave, second wave, and third wave, it is moderate to severe to mild. It is becoming, and then the good news is that we are getting better, and virus is becoming weak. And he made it very clear. There is a very good point for every one of us that who has to go to hospital or who has to be hospitalized. The saturation levels should be less than 93 if it is. And if you have severe cough and the temperature levels are over and above 102 degrees Celsius. So these are all the 3 major things that we have to take into consideration. I repeat again, saturation level should be less than 93. And the severe cough should be there for the patient. And then the temperature should be over and above 102. So that is one thing. And then he made it very clear that, we are better off as a nation in the whole world to deal with the COVID, whichever the stage it is right now. And the immunity levels should go up to tackle this one. And then I think herd immunity is going to make sure that, the whole world will come out of this COVID-19 as soon as possible. And the good thing that what he has mentioned for every one of us is that, a lot of patients are coming to the hospital, but not more than 2% of the patients are not getting hospitalized. That is a very good news that what we have. He has mentioned about a lot of therapies that are all available right now, right from remdesivir to cocktail to so other things, and then it is the prerogative of the doctor after seeing the patient which therapy is needed for him. And we are thankful to Dr. Nagesh to make a point very clearly that the people who are all eligible today over and above 60 years, they should get the booster dosage as quickly as possible, which in our one city that we are arranging for the booster dosage, and then people can take it. And one thing that he left it for the benefit of the people to decide are, after reading the journal and all, Covishield, if you have taken the first 2 doses, better to go for the booster dose Covishield only. And similarly, Covaxin, if you have taken the first 2 doses, go for the Covaxin only. So I think, these are all very, very valid points that he has mentioned. And then, we will come back to you, Dr. Nagesh, for any questions being posed by our attendees. And now I will turn the mic to Dr. Srinivas Reddy, the pediatric specialist, for his presentation. And then, because every citizen today is very much worried that, because the third wave is going to hit the children. And some news says that it is going to, and some newspapers or, channels, they say that we need not worry much. But let us listen from the horse's mouth. And I request Dr. Srinivas Reddy to go for his presentation on this important topic.
So, is he audible?
I think, any one of you should speak so that, it will be much more audible for us, one after the other.
Yeah. Is he audible?
Yeah, he is not audible. You are audible now.
Okay. So, when compared to second wave, third wave is going to hit only children, this myth is going on, but it is not. The fact is, in the first wave and second wave also, how many number of adults got affected, those many number of children also got affected. So what we are having the data is equal number of children are affected like adults. So there is no point that only children are going to affect. So children are going to affect equally even in third wave. But the incidence of so what to do? What to do about the present condition? So there is no panic and no anxiety. And even though we see many number of cases due to Omicron, still the symptoms are mild in children. Still the symptoms are only fever, cold and cough. So fever will give only just paracetamol, and the treatment modalities are only depends upon the grading of the symptoms. Like we'll categorize the symptoms, whether the symptoms are asymptomatic or mild, moderate or severe. Asymptomatic means when only parents got affected and the children are just only they are staying with them and they are not showing any symptoms like fever or cold, cough, nothing will be there. Those are called asymptomatics. And mild symptoms, when we will say child is having fever for only 1 or 2 days and only cold, mild cough, this is called mild symptoms. So when do we say how to identify that our children got moderate or severe? So if children is having temperature for more than 3 days, will follow rule of 3. That means if the temperature is persisting for more than 3 days, then will first rule of 3 means first 3 days, 3 to 6 days, and more than 6 days. So first 3 days will treat only symptomatically, like if child is having fever, we'll give paracetamol. If child is having cold, we'll give only cold medicine, and the cough, depending on type of cough, we'll give cough medicine. But after 3 days, 4, 5, 6 are golden days, even for adults or children. So 4, 5 days, if child is having persistent fever, not taking any feeds, dull, dehydrated, in that case, we'll keep the child in hospital and we'll treat. But there is no role of remdesivir or steroids in children, but steroids we can give till some extent. Remdesivir only above the age of 12 years only we are giving. In my experience, in last 2 years, we have admitted only 3 children for COVID. Remaining are adults only. So those 3 children also only they are not eating well and sick, dehydrated. For them only we got admitted and they got better. So if the child is able to, so do children need isolation? This everybody will ask. So if the child is able to stay alone in the room, isolate them as they may infect elders in the family. But if the child is below 5 to 6 years or cannot be handled by themselves, or any of the parent can stay with them, with the kid in isolation room, and wear the mask when you are being with the kid, so that the other elders will be safe. So actually, if mother is breastfeeding, means giving the feeds to the newborn baby or any less than 1 or 2 years baby, they can feed the baby, but while feeding they have to wear the mask. That is the only important thing, and they should not isolate the baby. Better stay with the baby, and while feeding just keep a mask. So when do you need to get doctor appointment? Again, the same rule of 3 will follow. Continuous fever for more than 3 days. Abnormal movements of limbs due to high-grade fever. Even not only any other viral and bacterial infections, even in COVID also, some children will get febrile seizures. Febrile seizures means whenever the child gets more than 103, 104, some children will have genetic tendency and some children will have this febrile seizures. Unlike adults, children they are also present with loose motions and vomitings and pain abdomen. Generally, in adults, only fever, body pains, cold and cough. These are the presenting symptoms in COVID. But whereas in children, loose motions and vomitings also is the presenting symptom in COVID. And severe abdominal pain and fast breathing and chest retractions. So fast breathing and chest retractions, how to identify? That is very important thing, because parents, what they'll think when child is dressed, child is doing good. But if you open the shirt, they'll take the respiration more than their age. In that case, we have to analyze that the child is having any moderate or severe disease. So if you want, we will share the respiratory rate, age appropriate child also. We will share afterwards. So if any child is taking more than age appropriate respirations, you have to consult us. So how to check the respiratory rate? If you are not knowing how to count the respiratory rate, you don't know, so what we have to look up. So what you have to do is make the child on lying down position, and how many times the abdomen is moving up. This is called respiratory rate. So how many times child is taking respiration, that you count. If the respirations are more for the age, definitely you need to consult the pediatrician. Do they really need testing? This part is covering by Dr. Lavanya.
Yeah, hello all. Am I audible?
Yes, ma'am.
Yes, ma'am.
You're audible.
Do children need testing? That's what all the parents are asking nowadays, because the condition of the children won't be that symptomatic, and sometimes they are asymptomatic also. But whenever there is a patient in the home, they need to get tested whenever there is like a child presents with the symptoms, to safeguard other elders in the family. Uh, Whenever they are going for the test, you have to go for a properly ICMR guided testing lab only, and do not truly depend upon the rapid testing kits, as they may give 70% of false negative tests, and they are more likely directed to the S gene now. And but whatever the Omicron variant is present now in the population, like in community now, it won't be giving positive results in the rapid testing now. So better go for RT-PCR. I know it is very difficult for the kid to get nasopharyngeal swab. At least oral swab they may get, and they may report for that also. So, and we strictly uh, say no for X-ray or CT scan for the children, because it is not at all necessary for the children. And do not go for any fancy blood tests also in children, which are circulating in the groups, like D-dimer, serum ferritin, or all fancy tests you may see in the groups also. But we won't advise them for the children. But for the adults, we advise for the mild cases, don't go for CT scan, just go for normal blood tests like CBP, CRP, or D-dimer test like that. Even them also, we are not advising now IL-6, serum ferritin, all LDH levels and all. They are not necessary for them. Depending upon the condition of the patient, we have to go for the testing also, and don't spend so much of money on the fancy tests. And consult your doctor before going for any investigations. You don't go by yourself and go tested for so many tests, and don't drain your purse also. And depending upon the child condition, your doctor may advise further investigations also. Usually they'll just go for CBP, CRP. That's it. And we can treat the patient so happily with those tests only. Don't go for other tests. This is my sincere request to the patients, and even to the parents, because they are so much in anxiety, and they'll ask and they'll force us to give a number of tests to them, so that they have to be in safer side. But it is not at all recommended, and you just have to go for the tests which are recommended by your pediatrician. That is only CBP, CRP they'll ask for. And sometimes if the child is asymptomatic, we won't ask for those tests also, because those are not necessary. We can treat them with the simple paracetamol and simple sponging and simple cold medication, and nasoclear and simple sponging, simple dehydration medication like ORS and all. They'll be treated and they'll get fine in 2 to 3 days. You just need to be little patient, and your child will be out of danger. And you should not force your doctor to write antibiotics also, which are not at all advisable, and do not misuse them. And coming to the vaccination part in the children, now we are only giving like a 15 to 18 years age group is now we are giving vaccination for the children. We are expecting at least after 12 to 18 years age group in a couple of months, I think. And my sincere request to the parents is just send your kids to the schools whenever the government opens them, because staying in the home or almost 2 years is more dangerous than sending them to the schools. So please send them to the schools and encourage them, and please be careful and teach them how to mask them up, and sanitization and all. They are easy learners. They can just get into that, and they can easily manage than the adults. So please go through that and send them to the school. Hopefully we'll see our children in school soon. Thank you.
Thank you so much, Dr. Lavanya, and then Dr. Srinivas Reddy. I think there are very good takeaway points, especially from the point of view of pediatrics. And Dr. Srinivas was talking about, don't please come out of the myth that, is going to affect only the children in the third wave, and then the equal number that has been noticed in case of children and as well as in case of the adults also in third wave. And he was also categorizing that, asymptomatic, and then mild symptoms and then moderate. And especially he was categorizing that, how you have to test whether the children are having COVID or not. He was telling that, first you check that whether the temperature is consistently and persisting for 3 days. And then also the temperature medicines can be given at the first 3 days. And the cough, you check it up and then give cough medicines. And then if it is persisting more than about 3 days, I think, you need to be a little bit worried, number one. And number two is that, also understand whether the child is having a fast breathing or loose motions or vomiting or in a persistent fever and all those things that I was talking about. And in case of the kids, they definitely need isolation, and parents should be available with the children who cannot, on their own take care of the isolation process, and not to worry, and then wear mask and then take care of the kid. And the breastfeeding need not be stopped. The only thing is that, the mother should wear the mask while feeding the kid, and need to take a doctor's appointment as and when it is required, not to wait too much. And Dr. Lavanya is talking very nicely about the testing procedure. She's telling that not to go for rapid test and all, go for a proper testing of RT-PCR, and also telling at the same time that a very critical one, don't go for fancy tests for the kids, and then don't pressurize the doctor to write antibiotics, and especially don't go for x-rays and then CT scan in case of the kids. It's a wonderful one. And then at the last, while closing, she made it very clear that, please don't get worried about the Omicron or the third wave what we have. It is more dangerous to keep the students or the kids at home rather than sending to the school. I think, that is a very good statement, a bold one, that the parents should take and then run with it. I think, with do we have the other Dr. Priyank available with us? Ravi, did you see Dr. Priyank joining
No,
with
I
us?
think he's.
Okay.
No, I
I
think
think,
he's.
I think, Dr. Priyank is having challenges at home to take care of the kids there. So that is the reason, though he promised he could not able to join, otherwise he did. And then, he ventilated a lot of good ideas in the 1 year back when we have conducted the similar session. I think the floor is open for the people to ask questions. So whoever wants to ask a question, they can ask. Otherwise, I can unmute them and they can also ask. Just you please raise your hand so that I will unmute you. Otherwise, you can type in the chat so that we'll ask the question.
See, actually, I got a couple of questions through WhatsApp. I just asked those questions before others.
No, let me 1 second. Hold on, Ravi.
Oh.
Shreya wants to ask a question. Raise the hand.
Okay.
So let me make her to ask the question. So,
okay.
Shreya, you can speak now. You can unmute yourself.
Yes. Hi, hi, RK Garu. So my question is actually regarding the COVID for the children. So currently in my home, we are almost 5 members. We are COVID positive, and I have actually 2 children. Both are also having high fevers currently, like a 5-year-old who is having 1 or 2 fever, and also newborn. So what are the precautions do we need to take for the newborn?
Sure.
Who is actually 6 weeks old?
Sure. I think, this is more like a pediatrics kind of a question. I request Dr. Srinivas Reddy to give an answer.
Hello, Shreya.
Yes, sir. Yes, hi, sir.
If you and your younger together in the same room, while feeding, you only come with mask.
Some echo is coming.
Yeah, the voice is breaking.
Oh, just a minute.
Except Dr. Srinivas Reddy, I request everybody to go on mute, including Sriya.
So, our guidelines, what they are telling is, when children like breastfeeding babies are there, baby and mother should stay together and cover the mask while feeding. Cover your nose by mask, and you can feed. Remaining time, stay away. Stay away means 1 to 2 meters distance. Maintain distance, and at the time of feeding, you can cover mask and you can feed. But stay together in the same room. And for newborn baby, no need to give any other medication except for symptomatics. Symptomatic treatment only. Suppose if fever is there, only fever medicine. Cold is there, you can give only simple cold medication. No need of antibiotics, and there is no role of any antibiotics. Give more frequent feeds for the baby. Why? Because suppose in case of adults, we need to give plenty of liquids as well as nutritious diet. For babies, only mother feed is will give water as well as food. So encourage more feeding. That will only help the baby. More antibodies will come from the mother, and that will help the baby to recover fast.
Okay. Yes. Thanks. Sir. So I have another question. Like another person in my home is also tested COVID positive, who is actually having asthma. So what are the precautions, and what do we need to carefully monitor in that case? And how this wave is actually affecting the asthma patients?
Asthma actually is a symptom of lower airway. So lower airway, fast breathing as well as cough. The only exam after examination.
Sriya, please go on mute. Yeah.
Asthma can be only diagnosed by examination only, by stethoscope only. With the stethoscope only, if any wheeze is there, we can say it is asthma. Otherwise, pneumonia will be pneumonia picture also will be same. The differentiating point from asthma and COVID is, in case of asthma, mostly there will not be any fever. Whereas in COVID pneumonia, history of fever, then followed by fast breathing. You need to monitor respiratory rate. Even respiratory rate will be more in case of moderate asthma also. But asthma will be diagnosed only clinically. Only with by examining with the stethoscope only we can say whether it is wheeze or any simple coughs.
Yeah. Thank you. Thank you so much.
If any already
Thank you so much.
already known asthmatics, they should have to use the inhalers. They should not stop the inhalers. Okay.
Wonderful. I think, Dr. Nagesh, would you like to supplement
Yeah,
on this?
the answer to to add what Dr. Srinivas Reddy said, asthma can be a comorbid factor for people to fall, sick for COVID. So probably someone who is non-asthmatic with COVID and asthmatic with COVID, the recovery as well as the presentation itself will vary between both, because this particular patient has got asthma, and then there's a chance of him presenting a bit more aggressive than the one without asthma. And I think the important points what we need to understand, we should not target 99% or 100% of saturation in people with asthmatics and COVID pneumonia, because the saturation in the target saturation for asthmatics with COVID, who presents usually with the moderate kind of a disease, should be between 88 to 92%. So this is one important point I think we need to remember. Someone who is asthmatic and then he's got COVID pneumonia, don't expect him to drive his saturations 99, 100, 98 and all that stuff. Somewhere between 80 to 92 is able to maintain. I think it's okay clinically. I mean, obviously it all need to be substantiated with the clinical presentation and the laboratory evidence and radiological evidences as well. I think apart from the regular treatment of COVID in asthmatics, as Dr. Srinivas rightly said, the other asthmatic medication, anti-asthmatic medications have to be continued, and probably the steroids dosage will be monitored and will be tweaked as per the presentation.
Wonderful. I think, Shreya, your questions are answered. Thank you for asking the questions. And I think, please follow the instructions, whatever has been given by the doctors, and then you can run with those things. Yeah, Ravi, you said that you have some questions. Somebody has
I got
some
few
questions.
questions.
Yeah, please.
Few people posted questions. So first question, I think again for Dr. Srinivas Reddy. I think there is some message floating that after children took the vaccination, you should not use paracetamol and all, right? Is there anything like that, or after vaccination, children have taken vaccination? Is there any restriction on taking any medication?
Okay. After vaccination, if child get fever, we can take paracetamol. Paracetamol is recommended actually.
Okay.
Is that the only doubt?
Yeah, I think that's the question somebody asked.
After vaccination, paracetamol if child gets fever. Otherwise, no.
Okay. I think the second question is for Khyati, Dr. Khyati. If I think it's a tricky question. Is this this wave, the transformation of this virus from wave 1 to 3? Is it going to be milder going forward, or do we see another lethal one coming up, or is it the end of it? I hope it's the end of it, but I would like your hear from you, Dr. Khyati.
So what we're seeing is the movement of the virus from pandemic to endemic. There are chances that we may not see any new wave. That's the larger likelihood, and that's why there was a huge gap. So when you see the trend, first wave was there, and then immediately after, after 6 months, we saw the second wave. But third wave took some time to come in, and it's taking its own time to peak because the number of cases have already started to decline. There is a likelihood, and especially with countries trying their level best to start vaccinating and finish the vaccination of people as quickly as possible, there is a chance that this virus would now become more endemic, the way we see measles. Measles was also once a very deadly virus. Measles has actually cleaned out towns and villages, but that's the kind of fate that epidemiologists are expecting. The only thing that we need to do, and our end needs to be held up, and for that we may need to avoid any kind of transmissibility, because that's completely that we can do. Of course, vaccination and other things are something which other people are taking care of, but trying to limit ourselves in terms of wearing masks and avoiding crowds and other things is what will help the wave to become shorter and less stronger. That's what I have to add at this point.
Okay, great. Thank you, Khyati. I think it's music to ears. So hopefully, this thing ends. Thank you. I think the third question, again, maybe one of you can pick up, is most of us, whoever got the COVID nowadays, probably they've taken a 7-day quarantine, and maybe with mild symptoms they got cured, right? Anything specific precautions they need to take post COVID? This 7 days, do they need to take any specific medication or any precautions because it's more of a self treatment in most cases in Omicron wave, right? So that question, maybe Dr. Nagesh, you can take that, and then maybe others can add.
Well, I think post-COVID, the one and only message that goes out very loud is hydrate yourself and take nutritious food. That's the first and last, probably the one-liner that should go to everyone post-COVID. I think it's about hydrating. Hydrating is nothing but taking lots and lots of fluids. Lots and lots of fluids doesn't mean that you take lots of fruit juices and then say you're taking lots of fluid. I mean, water should be preferred, and a nutritious food is what is ideally required. It's not about high calorie or a low calorie. Probably it should be a very nutritious, high protein rich food is what is required. There was some sort of a myth about consuming contradicting consumption of red meat and all that, but I think now it is pretty much okay. Neither they advise nor they don't recommend. But I think the most important is keep your diet as nutritious as possible with more protein, and hydrate yourself as much as you can. At least 3 to 4 liters per day is what is required. And there'll be lots of weakness, and I think recently I was again positive for the last 7 days. What I could understand comparatively, I was infected once with Delta in the wave 2, and again I'm infected now. But even now, I think it's Delta. But the symptoms, my personal experience compared to Delta, compared to wave 2 and wave 3, the symptoms are much worse this time. I have no idea what's the reason, but I think the symptoms was, the cold. It could be cold, it could be cough, it could be, kind of headache, body pains. It was they're very on a higher side, and the severity was much higher comparatively to the last time. I think so. All of us have to definitely practice a bit of caution. Don't be negligent. At the same time, don't be panic as well, because we are absolutely doing much better in tackling and handling wave 3 comparatively. So I think keep yourself hydrated and then take good food, and don't neglect if in case if you continue to have sore throat and any kind of fever after you sound negative, after you tested negative. So please do remember, uh, fever coming back and sore throat and then all the symptoms of COVID coming back after testing negative needs a bit of attention.
Good.
Thank you.
Thank you.
Thank you,
One
Dr.
more
Nagesh. I think you said two bottom line points is be hydrated, take nutritious food post COVID. Thank you. Thank you so much.
Yeah. So one more question to Dr. Srinivas Reddy is that, ఒక lady ఆమె పంపించారనమాట. She says that, her kid is not having a continuous fever, on and off fever ఉంటుందంట. And కొద్దిగా is having a little bit of nausea and a vomiting sensation ఉంది. But continuous గా ఐస్ రెడ్ గా అవుతున్నాయి అంటున్నామే. Is it because of COVID ఏంటి అని her question is.
ఫస్ట్
ఫీవర్ ఉంటుంది.
టెస్ట్ చేయించాల్సిందే కోవిడ్ టెస్ట్. అంటే కోవిడ్ సిమ్టమ్స్ కెన్ బి ఎనీథింగ్, లైక్ అన్లైక్ అడల్ట్స్, చిల్డ్రన్లో కంజంక్టివల్ ర్యాష్ అంటే కళ్ళల్లో రెడ్నెస్ ఉండడము, వామిటింగ్స్, ఫీవర్, కాఫ్, ఇట్లా వేరియడ్ ప్రెజెంటేషన్ అన్ని రకాలుగా ఉంటుంది. ఫస్ట్ గో ఫర్ టెస్ట్.
ఓకే, టెస్ట్ చేయించమని చెప్పి, ఎందుకంటే లాస్ట్ 2 days నుంచి బాబుకి ఆన్ అండ్ ఆఫ్ గాను ఫీవర్ వస్తుంది, నాట్ కంటిన్యూస్ గా రావడము, ఆన్ అండ్ ఆఫ్ గా ఫీవర్ వస్తుంది, అండ్ దెన్ వామిటింగ్ సెన్సేషన్ ఉందని చెప్పి అంటున్నాడు బాబు. హిస్ ఏజ్ ఈజ్ అరౌండ్ 8 years అండి, అండ్ కళ్ళు మాత్రం ఎర్రగా అవుతున్నాయని చెప్పాడు. అంటే సో బెటర్ టు గో ఫర్ టెస్టింగ్, రైట్?
ఫస్ట్ చేయించాల్సి.
ఓకే, థ్యాంక్ యూ డాక్టర్. Do you have any questions from the attendants?
I see one question from, I think probably it is covered by doctors, that how important the booster dose is. I think that is kind of covered, I guess. So I think doctors suggested that, if you are eligible for booster dose, go ahead and take it. It's very important to take it.
Yep.
Okay.
So and then see one more very generic one. I think people have already answered. The doctors have already answered. But again, I got one more message that is it the? I think it is very generic one. Is it the beginning of the ending of the pandemic? I think Dr. Kathy told. But Dr. Nagesh, I think with your experience and having both in management and as well as in treating the people, can you please pitch in and tell us that this is the beginning of the ending of the pandemic?
Sorry, I lost you. Hello?
Yeah, can you hear me now, Doctor?
Yeah. I can hear you.
Yeah. See, I think Dr. Kathy already touched this point. Again, I got one more question in the WhatsApp. They were asking the question that is this phase is the beginning of the ending of pandemic?
So, I mean, that's what I think Dr. Kathy clearly said. It's going to get into endemic state. Endemic is nothing but, it's a disease which prevails in the community. And all of us will tackle it because we'll have herd immunity coming into action. Herd immunity is immunity acquired by the community to fight against this disease in the form of antibodies inside. So I think, I mean, all of us should be positive and then look the way the disease is progressing. I think we all hope that it will be the beginning of the ending of this pandemic. And even the history says, the pandemics are usually they end up by becoming endemic, and hopefully, I think that's what is going to happen for the same.
Yeah, and one more tricky question, and then very important one is that today in India only the people eligibility for booster dosage is over and above 60 years.
Yeah.
But that is not the case in case of the advanced countries. Okay.
True.
So is it because of non-availability? Is it because of non-availability, or people are very much worried? Government is worried that there will be a mad rush of people going for booster dose, or is it not necessary because of the tropical climate, or we can wait and watch to go for a booster?
It is about the booster dose concept is one is yes, availability of the doses is one challenge definitely. The other challenge is there are no enough publications or enough research on the booster dose so far. Even the government today is not in a position to clearly give us, there are some countries who are practicing the first dose, second dose can be anything, and the third dose can be, you can change the third dose. And so there are lots and lots of arguments on this, and the government is yet to come out with the clear-cut guidelines on booster dose and its and its eligibility criteria. So there are two challenges right now. Is one is production of the vaccines, and number two is about the bringing a much more research into booster dose and its efficacy. I think we're all waiting for the same, and then I think very soon probably government will open the doors for everyone for booster dose. And now India having such a 1.3 billion population, I think you can't just announce a day and then say everyone can rush for go for the booster dose. I think there's a particular kind of strategy that the government is trying to put into the place, the phase-wise kind of a strategy. I think apart from that, there's nothing else that anything serious that would actually stop us to go for the booster.
Thank you, Doctor. I think before I ask the next question to you, especially from my perspective, I want to give the mic to Srilata to ask a question. Sure. Srilata, can you please go ahead, unmute yourself and ask the question? Madam Srilata. Okay, before she unmutes herself and then asks the question, I want to ask you one more question. This is purely from my side, Doctor. The question is that as you said that if the people have already taken the first two doses of one particular brand of vaccine, suppose for instance you have taken Covishield first and second dosages, and the booster dosage is better to have Covishield, okay, and similarly Covaxin, the Covaxin. But I have a lot of friends in the United States, even the doctors also. What they are suggesting is that the cross-ones are also okay. If you have taken Pfizer first and second dosages, Moderna is better to go for the booster dosage. So I was a little bit confused when you said that, by reading the articles, this is what it is. So this is purely for my.
Absolutely, sir. That's what I
Yeah,
said, sir. I mean, even many of my counterparts outside India
yeah,
actually, recommending probably the clinic. Even our clinicians in our own hospitals are actually recommending to go for the cross vaccine
yeah.
rather than going for the similar vaccine, because the ultimately the vaccine works by the antibody production in the body, and
Yeah.
they feel that the cross vaccine might actually benefit
Yes. Yes.
people who are getting vaccinated more than
Correct.
the regular kind of vaccine that you take. So even I'm in favor of going for the cross vaccine. I myself am actually going for the cross vaccine, to be very honest with you. uh, so
Wonderful.
it's again, it's an individual opinion and a decision, which needs to be substantiated with lots of research. Unfortunately, we don't have much of papers published on the same, but I have a couple of papers which were published in Israel. I can
Mhm.
actually forward it for the reference sake if anyone wants
Yeah.
it. So
Please. And apart from that, doctor, not only you, even for Dr. Srinivas Reddy and then Lavanya, please, share your presentation, that we will put it in the public domain, so that all the attendees and non-attendees will get benefited out of this information. Actually, how to deal with the pandemic. So I think Madam Srilata, you can ask the question now.
This is a question to Dr. Nagesh regarding any advice precaution in pregnancy with COVID.
yeah, ma'am. Though I'm not an expert in this particular subject of pregnancy, but I think we do understand the pregnancy. We have seen very very few people who are pregnant infected with COVID. I think the most important is the therapies that we use against these pregnants are very important, that we need to remember. There are some therapies which are contraindicated in pregnancy to treat them. Otherwise, the first trimester and the third trimester, I mean, the first 3 months and the middle 3 months, I think there shouldn't be any issue. I think it's only even the second trimester. Initially, they said there's a bit of risk to the child, but I think now it clearly says there's no much effect on the COVID transmission through the placenta, though it happened, but there's no much effect on the kid because of the innate immunity that is present. That is number one. There's another, recently the CDC study have found out that there is no increased risk of miscarriage after vaccination in the pregnancy. So there was initially, they said there can be a risk of miscarriage if the pregnants are vaccinated against COVID-19. But I think now the recent guidelines, which were released around 3 months ago, and a paper published by CDC clearly says there's no much of a risk of miscarriage, people who are getting immunized and they're pregnant. So I think there's nothing much to worry in pregnants with COVID. All that they have to is definitely they have to get an access to the doctor, and then understand which trimester they are into. And if it's a precious pregnancy is pregnancy which is actually after a long time that they got the pregnancy on. And if they get infected with COVID, I think these people definitely have to be under the monitoring of a doctor. So otherwise, there's no much specific advisory which is a bit of critical for pregnancy with COVID.
Yeah.
Thank you very much, sir.
Sure, ma'am.
Thank you, doctor. I think, Sridhar, I have given you the mic. Mr. Sridhar, you can ask the question. You can unmute yourself and ask the question.
Yeah, hi. I want to know the steps that anyone has to follow and in which order. Let's say I got COVID tomorrow, and first 2 days, I think it will take time for me to uh, go through that and see if it's looking like some different, because I haven't got COVID yet. So if I feel that, okay, these are really different symptoms that I never experienced, so I can assume that it's mostly COVID. And after that, what are the next steps? So I need to buy some tablets like paracetamol and vitamin tablets, inform prop care, and after another 2 or 3 days, if it's still progressing, and you mentioned we need to visit doctor or hospital. So which hospitals I need to go to? Means any hospital I can, but if there are any specific hospitals, and yeah, like what is the order and
So the
the
first
plan?
and foremost, I think to answer your question, the symptoms are very important and you need to be well aware about the symptoms that you're going through. The most common symptoms between Omicron and Delta are fatigue, headache, running nose, sore throat. These are the common symptoms between Omicron and Delta. So can everyone have all of them? Answer is no. Can can there be, some people might only have a headache, runny nose. Some people might only have sore throat and fatigue. So, but these are the most common symptoms. Fever can happen with both again, but these are, it can happen sometimes. The frequency, if you understand, the first four complaints are most common, and then the following order is sneezing, chills and rigors, persistent cough, fever. So these four complaints can actually, sometimes they can, and sometimes they might not even present. Loss of smell is very, very predominant, which can happen with Delta, and it is very rare in Omicron. As far as the clinical presentation so far are concerned, the loss of smell used to be the most common significant symptom for Delta, and Omicron, it's a very rare symptom that we see. Difficulty in breathing, it's again a common complaint, not in the common complaint, it's a complaint which is seen sometimes in Delta, but very rare in Omicron. Sorry. So these are various symptoms that we see between these two variants. And so first of all, you need to be aware about the symptoms that you're going through. And if you fall into any of these symptoms that we just mentioned, you have to see if you have a gadgets at your home to measure your temperature and to measure your saturation. If your temperature is riding high and if your saturation is not above 98, 99, it is somewhere between 96 and 97, and you have difficulty in breathing, you have fever, you have sore throat, you have cough and all that, I think now that's when probably you need to understand there are chances of you getting tested positive for COVID-19. Now, going for investigations, again, it's more of a subjective rather than objective. Going for the investigation is like generally a doctor can advise. Nowadays, even you can actually understand if you fall into the criteria of these symptoms and then you think you should get tested. You can always test because it is easily accessible across. Now, so in investigations, again, RT-PCR, you have and rapid antigen, and I think the other doctor have clearly mentioned about what are the advantages of RT-PCR over rapid antigen. Now, you get tested or you don't get tested, the answer is you need to isolate. So the step number 2, first you identify your symptoms. Step number 2, you decide you want to go for the testing or you don't want to go for the testing. You want to go for the testing, it is better you go to the doctor and then get tested, and so that you understand much better. Or if you want to go for testing on your own, please go ahead. That's up to you. Step number 3, you test, you don't test, isolate yourself from the other family members or the other friends that, who stays with you. Now, once you isolate yourself, you ensure that you continue to record your temperature and your saturation at least twice a day for the next 3-4 days. If your temperature and if your saturation is actually coming down day to day, it means you're doing well. If your symptoms are getting worse, your temperature and saturation are also getting worse, you need to be alarmed. And that's the time. If your saturation is falling less than 93, and if your temperature is going high, one or above 1 or 2 for consecutively for the 3-4 days, then it's a time for you to knock the doors of hospital. That's step number 4. Now, step number 5. Once you knock the doors of hospital, which hospital do you need to? Your question was, can I go to any hospital, or is there any specific hospital that you can go to any hospital as long as it has been listed by the government of Telangana to treat COVID disease. So any hospital you can go and you can see any clinician, preferably pulmonologist, but to that matter, even COVID, even the general medicine or any other qualified doctor can actually treat. So go to any hospital which is listed in the COVID treating centers as per the government of Telangana GO is concerned. Now, once you go to hospital, it's then the ball goes into the hands of the doctors and the hospital to decide what is good for you and what is to be done. So at that moment, I think I have already briefed about the therapies available as on today and therapies which are not listed and which are delisted. That's just an idea for you to understand what you're actually receiving and is it good for you and not. So once you go to the hospital and once you get get the attention of the doctor, I think probably you don't have to worry much. After the discharge, you have to continue. There is something called spirometry. It's an exercise. I think I forgot to mention in the previous question. Someone was asking post COVID. Is there anything that we need to take care? I said rehydrate and good nutritious food. Along with that, if someone had severe cough and all that, I think you should also focus on doing the chest exercises, which is spirometry. So now, once you get discharged from the hospital will always recommend you to go on spirometry for some days so that you get your lungs back into the shape in case of severe infection and if there's any lung damage. So apart from that, I think once you're discharged, you're supposed to again watch for your symptoms. There are chances of reinfection. During the wave 2, there were lots and lots of reinfections which have happened. That is most important. Another important point is post-discharge, you need to understand if there is anything that, you have eyes swollen, severe pain in eyes, and you have some sort of a black fungus material in your nose, and so which is again a mucormycosis, which we hardly see these days in the third wave. But I think it's as a point of mentioning, I think you need to understand post-discharge from the hospital, you need to keep an eye on your symptoms if they are again coming back to you, and on your chest exercises, nutrition, hydration, and if there's any sign and symptom of mucormycosis in case. So these are the different steps probably you can follow, and I think if there's anything, it's not a diagram which can actually be drawn and say everything will go like this, but I think there will always be some deviations. I think most of the steps that you can think of and to follow is, I think this would be good enough for you.
Yeah, thanks. And one last thing. I myself and my kid stays in the home, and this infection starts with one person. Suppose I got infected and you said we need to be isolated. But being in the same home, the chances are high that other two people can also get infected. So can we stay freely, and I just take for granted that, okay, even if they get also, it's fine, and we all take precautions, or means I don't know, but
No, I mean, I didn't get your question, sir. I mean, you're trying to ask me. We all stay. Sorry.
Let me elaborate the question, Dr. Nagesh. So what Sridhar says is that, suppose for instance, నాకు వచ్చింది అనుకోండి, మేము అందరం ఫ్రీగా ఉండి పిల్లలకు కూడా వచ్చినా కానీ అందరూ కలిసి ఉండొచ్చు కదా, ఇంకెలాగో ఎందుకంటే బికాస్ నేను అలూఫ్ గా ఉండి ఐసోలేట్
మీరు రిపోర్ట్ చూసినట్లయితే COVID-19 మనం రిపోర్ట్ చేయించుకున్నట్లయితే అందులో దే విల్ గివ్ యూ సంథింగ్ కాల్డ్ సిటీ వాల్యూ. సిటీ వాల్యూ అనేది ఏంటంటే ఎంత హైగా ఎక్కువ వైరల్ లోడ్ ఉందా, తక్కువ వైరల్ లోడ్ ఉందా అనేది చిన్న ఇండికేషన్ ఇచ్చేది అనమాట. సో సిటీ వాల్యూలో ఎక్కువ వైరల్ లోడ్ ఉన్నది అని వస్తే కనుక ప్రాబబ్లీ దే సే దట్ పర్టికులర్ పర్సన్ నీడ్స్ టు బి ఐసోలేటెడ్ ఈవెన్ దో there are others who are positive because he carries high viral load. Again, let me also be very clear on this. Idantha kuda, it's all a discussion. It's all, a different స్కూల్స్ వర్షన్ అంతే. దీనికి ఒక సబ్స్టాన్షియల్ ఇది లేదు. బట్ సిటీ వాల్యూ హై వచ్చినప్పుడు హై వైరల్ లోడ్ ఉన్నది అని అయితే మాత్రం ఉన్నది. సో హై వైరల్ లోడ్ ఉన్న వాళ్ళు, లో వైరల్ లోడ్ ఉన్న వాళ్ళు వీళ్ళందరినీ కలపడం ఓకేనా? ఎనీవేస్ ఇట్స్ సేమ్ వైరస్, హై ఉన్నా లో ఉన్నా ఏం ఫరక్ పడుతుంది? So these are all lots of questions even which are unanswered in our fraternity as well. But my personal advice is, I think, yes, if everyone is positive, it is good. I mean, I'm sorry, what I'm trying to say is it is okay to stay together as long as you maintain the same social distancing and then you keep your mask on. So I think that's important, what we all need to remember. So your CT score must be high, and the other person in your home CT score must be low. But I think ultimately, if you're living together, please live, but maintain the social distancing with mask on. I think that should be good enough for you to actually at least save yourself.
Okay.
Yeah.
Good.
Thanks.
I think one question is to Dr. Lavanya. I think WhatsApp that the question is that you said that don't drain your purse of going through several tests and all, but with this oral fab, RT-PCR test, will it be actual, or will it be having the accuracy as far as the children are concerned, Dr. Lavanya?
Can you repeat the question again?
The question is that with this oral fab testing of RT-PCR,
Yeah.
the child, if he is consistently having fever and all other things, will it give a proper result, or they should go for X-ray and CT scan?
No, they should not go for any X-ray or CT scan. They have to go for RT-PCR. If nasopharyngeal swab is not available, at least oral swab they can collect and they can give you the report. At least you can go for oral swab at least. But you should not go for any CT or X-ray.
Okay, not even X-ray also.
No.
Okay. Okay, thank you. Any other questions from anybody? If we don't have any question, then we will just summarize in a couple of minutes and then close it out. First of all, thank you so much for the doctors, Dr. Khyati, Dr. Nagesh, Dr. Srinivas Reddy and Dr. Lavanya to come over here and then take your time to enlighten us with a lot of things. The major good points that what we have noticed right now is that people are telling that it is the beginning of the ending of the pandemic. That is a very good thing. That let us hope that it is going to happen very soon. Herd immunity is going to come, and then our immunity levels, especially in the Indian subcontinent, will grow up, and then in our community, one city, we will handle it in a very better way. We have understood about the therapies, whatever Mr. Nagesh has informed us. The takeaway serious points for every one of us is that if your saturation levels are less than 93, and then if you have got sore throat, and then you have got abdomen pain and temperature is more than 102 degrees, better you go and then consult a doctor and then make sure that if necessary, then you have to go for the hospitalization. But again, the good thing and the numbers say that not more than 2% of the patients visiting the hospital are getting hospitalized. That's a very good thing. And the worrisome for us is that at this point of time, the graph is going up in all the major metropolitan cities like Mumbai, Chennai, Delhi, and Kolkata. But I think it is going to come down as per the news in the next 4 to 6 weeks time. And I think these are all the major things that what we have noted. And then with the help of Dr. Srinivas Reddy, the PPT, and also with the help of Dr. Khyati, we will take those PPTs and put in the public domain. First of all, thank you so much for everybody's attendance here. I hope that it is very informative session. And I also strongly believe that we will not be having necessity to have these kind of sessions in the upcoming months, so that the whole country and then especially our community will be dealing with this COVID efficiently, effectively, and see that we will be very healthy, and then we will be very happy in our one city. Thank you so much.
Thank you all the
Bye.
doctors
Thank you.
and the residents who attended. Thank you so much.
Thank you.
Bye-bye.
Bye-bye.